The following segment is sponsored by Healthy in Utah. Well, flu season is here and COVID is still going strong. Staying healthy is more important than ever before. Joining me now is Dr. Noble. Thank you so much for being here.
Hey, thank you. Yeah, appreciate being here.
We are so glad to have you. So now I have to ask, all of us are really focused on our health right now, of course, with COVID-19. How can we keep ourselves and our families safe?
Right, that's a great question because a lot of us are a little bit nervous to seek out some routine medical care that we usually do. But really the keys to being safe is following all the guidelines that we're encouraged to do between social distancing, wearing masks, washing hands, and those regular things. But the other thing too is not being too afraid to follow up on that regular health care that sometimes we want to kind of push off a little bit because some of us are a little bit nervous to go into healthcare facilities right now.
Absolutely. I wanted to ask because I know there was for a while saying only essential appointments were what we're supposed to be doing, staying at home. So if we have a routine healthcare check, or maybe even just a checkup, if we have a pre-existing condition like diabetes, should we be going into those appointments?
Yeah, that's exactly right. I mean, back in April, Johns Hopkins Medical Center published an article kind of saying that they think that their patient numbers have gone down about 20 to 30% of people not coming in for the regular follow-ups. I think most healthcare facilities have probably seen even worse drop-off during the height of the pandemic. And so imagine yourself as a doctor. And these are some of the things that I get in my clinic where a patient comes in following up on their diabetes. Now their blood sugars have been really out of control for a while. We're starting to see a little bit of damage to nerves, kidneys, eyes. And they say, Doc, can we fix all this now? And probably the better question would have been 6 months ago, Doc, could we have prevented this?
So you're saying we should go into all these appointments, even though we might be a little bit nervous, because the problem was we could have a worse issue if we wait.
Yeah, that's exactly right. It's exactly right. So sometimes I'm seeing a little bit of this in my office of people who just hadn't come in for their regular scheduled follow-up, kind of delayed, and now we're seeing worse outcomes. Similar thing for just preventative care. We think, well, if I'm feeling well, then why do I need to come in for maybe my annual wellness, my regular physical? But if we kind of push off those colonoscopies, mammograms, vaccines, regular labs, then, again, similar thing. If I have a patient in my office who I get their mammogram report back and it says, oh, now we found a lump and now we've seen maybe some evidence of spread to some lymph nodes, and they say, Doc, can we fix this? And I think, oh, it would have been a lot easier to prevent this. And, that's just kind of a bad feeling as a doctor.
Yes, absolutely. So make sure you're going in for those preventative care appointments. What about the flu shot? Should we all be getting that this year?
Yeah, great question, because the flu shot is not perfect, right? And the CDC puts out a lot of reports about vaccine effectiveness. And that VE number, vaccine effectiveness, is kind of hard to interpret sometimes because people think, oh, if it's only about 60% effective, why should I get it if it might not work a lot of the time too? But that's really showing you that if you contract the flu, you're 60% less likely to need a doctor at all, to need to go to the clinic or the hospital.
Okay, I like those odds. So everybody go to your checkups, get your flu shots. Thank you so much for joining us, doctor. And if you want more information, go to the website on your screen. Thank you again for joining us.
Absolutely. Thank you.